Well, this next one is probably interesting because we talk about exercising always beneficial, right? No matter what you do, if you exercise is good for you. Well, for one woman, her good habit has led to an issue she desperately wanted help with. Check this out.
In my early 20s, I was a swimmer, I was doing triathlons, and someone from the Olympic Committee saw me riding in one of the triathlons and sent me a bike and said I should start training for the Olympics. And 3 years later, I was at Olympic trials. During that time, I was training 8 hours a day. It was full-time. I love being super fit. There's nothing like it. I gained muscle really easy, 0% body fat, like ridiculously fit. My skin was, well, I was younger and I had a full face. When I look at the pictures now, I'm in shock. I could see it's a certain type of a look that someone who's been an athlete for a long time has. My face has gotten more like gaunt, this hollow cheek look and drawn. I've been so busy with life and accomplishing things that I haven't had time for dating. And now I really would like to get back into that. It's been a long time and I feel very self-conscious. This is the thing that stops me. It stops me from feeling good about myself, and it feels very superficial that I'm even saying this. Aging caught me off guard. My routine now is I do yoga 6 days a week. I swim 5 or 6 days a week, a little bit of cycling here and there. I feel great. I feel better than ever. But then I don't feel like how I feel inside matches my outside.
Cheryl is back in the procedure room with her doctor, board-certified plastic surgeon, Dr. Kian Karimi, and his assistant. So, Dr. Karimi, what is the plan today?
So we really see the very common sequelae of athletes face, which is losing our facial fat. We can see it here in Cheryl's temples. She's lost her fat, mainly in the mid-face here. She's lost her fat on the cheek. We see this big fold here in the cheek here. And also we see these folds around her mouth. And if you don't smile for 1 second, Cheryl, it really shows the loss of volume that we have. And using an innovative technique where we only have to poke the skin maybe 2 or 3 times, we can actually fill the entire face with injectables.
Oh,
And I know you're going to get started as we speak right now. And this is obviously not going to be done in just this segment. Dr. Karimi is going to be working with Cheryl throughout the show.
So normally if she would go to an office and have injectables done, she could have anywhere from 20 to 30 needle sticks to perform what we're going to perform in only about 3 needle sticks. So that's really the neat part of this technique. Go ahead.
And Doc, what will you be using for your filler?
So here in the temples, I'm using Restylane. In the mid-face, we're going to use Juvederm Voluma, and then we're also going to use Restylane for around the mouth. So here I'm using the cannula, and it's a smooth tip. It's a blunt tip, so it doesn't cause any bruising. It's bruiseless. And so that's really the innovative way that we're able to perform these injectables. And I'm able to travel back and forth. I don't know if you can see that, but I can travel back and forth here with the cannula and not create any type of bruising or trauma to the tissues. It's quite smooth.
And Dr. Karimi, really quickly, just because everyone out here is gasping, Cheryl, you're doing fine, right?
It's like nothing's happening.
See, okay, everyone, she's good.
I can't wait to see.
Dr. Karimi, I know you're going to continue with Cheryl and fill in all those spots you were talking about. And the best part is his plan is to be done so that we can reveal Cheryl a little bit later in the show. So we're going to let them finish up.